DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. We're going to have a great show today. We have Dr. Randall Spare from Ashland Veterinary Center. He's going to be here to talk about breeding soundness exams, fertility testing, bulls, and much more. He's a great friend, a great colleague. Stay tuned.
Bovolus Nasalgen 3 offers young calves unrivaled protection against devastating respiratory diseases, including IBR, PI3, and BRSV. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose Bovolus Nasalgen 3 PMH, the first and only intranasal that protects against viral and bacterial pneumonia. Talk to your veterinarian and visit nasalgen.com to learn more.
Hey folks, welcome to DocTalk. Look who we got here with us, Dr. Randall Spare. He's a friend, a colleague, one of the best veterinarians and men that I know, and it's humbling to get you away. You're so busy, so many things going on, so many people pulling you so many different directions, and he's going to spend a little time with us today. Welcome to the show.
Thanks, Dan. It's just a pleasure, and thanks for what you do for our industry. We really appreciate it.
Dr. Spare is the owner operator of Ashland Veterinary Center. You spend a lot of time with bulls, a lot of time with just in the beef industry, but breeding soundness exams and things like that is something that you spend quite a bit of time with.
You know, Dan, we do. We there doesn't a week go by throughout the year because we have several seed stock producers in our area, and they're always merchandising bulls. So we're fertility testing year round, not just in the spring of the year prior to breeding season. So, you know, we're thankful for the opportunity to have our hands on a lot of bulls and a lot of different types of bulls. And I think the understanding that they're a living creature. And when we test a bull, we're estimating, is this animal going to be able to service cows?
Yep. So let's get into a little bit, to just kind of set the stage of why we do these breeding soundness exams and why it's important to work with a veterinarian on this.
So if we think about fertility, or reproductive rate is our number one indicator of whether a ranch is going to be profitable. So we not only do we want cows bred early or bred, we want them bred early, and we want them to be bred within a short breeding season. So we need to know that those animals that we put into our bull battery are fertile and can service cattle.
Yeah, and there are things that can change over time. There are things that during a season or during injuries and different things of that nature that probably need to make sure that everything's functioning correctly, at least on day one when we put these bulls in.
So that being said, is when we fertility test a bull, I don't like to look at it to shoot the first moment when they come into the clinic or I'm at a ranch. I'm looking at those bulls when I get out of the truck. I'm looking to see if I see lame ones out there, see ones that are a little bit thinner, see ones that are maybe not so dominant that have been beat on. I try to look at ages to try to ascertain what ages of bulls am I working with. And so it's good to get the whole picture so that we don't become tunnel vision and only say, is this bull fertile? Can he produce semen?
Right. And I think that as it's no different than, I always tell cowboys in the feed yard, you can't diagnose lameness in a chute. I got to see him move. I got to see him, and so So I think it's very, very wise.
So we might even see lame bulls, and people will come in and say, well, this one's been lame, it's up in his hip. So I think it's important also as a veterinarian for me to promise myself to, if a producer wants to keep a bull, I'm going to pick up his foot and look at the bottom of his foot, because that lameness could be something simple to fix. If it's not in his foot and he's a mature bull, he, particularly in his back end, he may not even need to be fertility tested.
Right. If he can't mount a cow.
That's right.
Yeah.
So we look at those feet, we look at the shape of the feet, and we ask many producers, it may mean that they haven't have bulls in a small pasture. Maybe what are their goals? Maybe they purchased this bull from another seed stock producer or somebody else that is an older bull, but he doesn't need to cover a lot of territory. If he's in Missouri where there's one cow per acre and there's 20 acres versus in Texas County, Oklahoma, where cows are 1 per 30 acres, those bulls have to cover a lot of territory, and we have to have that understanding. And the bigger the picture we have, the better we're going to understand what's that producer's goals.
It's perfect. It's a great time to take a break. When we come back, more with Dr. Randall Spare from Ashland, Kansas.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
Valley Vet Supply sees the hard work and effort of you and your animals to achieve your goal of being a champion. And we're here to help along the way. To the cowboys and cowgirls, to the dreamers, we see you.
Hey folks, welcome back to DocTalk. Dr. Randall Spare, owner and operator of Ashland Veterinary Center in Ashland, Kansas, works with a ton of bulls, such a respected veterinarian internationally. And, let's talk about as that bull's coming to your clinic or you're out on the ranch, and just kind of walk us through a breeding soundness exam.
So Dan, first of all, we have to remember when we do a breeding soundness exam, we're looking, this is a picture in time. It's like looking at a balance sheet of a business. And we're looking at what happened to this bull or what was going on with this bull 60 days ago. So when we get him in, we're wanting to do a good physical exam. We observe his condition. We have him in the chute. The first thing I'll do is to palpate him and to feel his seminal vesicles to see if there's any swelling in there and to give an indication. So I have the mentality that this whole exam will tell me a story of, can this bull breed cows? That it starts with that physical exam. Then we measure his scrotum, and that scrotum has to be on a mature bull that's over 3 years of age. He needs to be a 34 centimeter scrotum. If he's a less than 15-month-old bull, he has to be a 30 centimeter scrotum. Those are standards that are set by the Society of Theriogenology. Those aren't what I pick. Those are the standards that's been set by a group of veterinarians. And when after we measure scrotum, we'll use an ejaculator. And my goal when I'm collecting a bull is to try to do it without vocalization. And it's part art, and it's part science, and it's part repetition, and just being able to do the opportunity to do thousands and thousands of bulls to get a sample collected. And older bulls, it's a little bit easier to get them collected. And so we'll want to see good extension. We're looking for the sheath to see if there's been any previous injuries, to see if there's any constrictions on that sheath to indicate maybe in the past year he was he was injured. And if there's any form of constriction where I don't think that bull will get his penis out and pull it back in, then we can stop the exam right there and make that recommendation that he probably won't be good. But here again, I'll ask the producer, here's what's going on. What do you want us to do?
Right.
So then once we see he's able to extend, we'll collect a semen sample. We'll put it under a microscope and we'll look at that motility. Now, one of the challenges is people will say, is there a lot or is there a few? So we want to just make sure there's plenty of progressively motile sperm.
Yep.
And then once that happens, and he has at least a fair motility. That's all the standard says, that we have to have fair motility. Most of the time on these mature bulls, they'll be very good. They'll be swimming in clouds there. And it's fun to show people what that looks like so that they know what's happening. And then once we give them the assignment of at least a fair motility, then we'll kill those cells and stain them and look them underneath of a little bit higher magnification. We'll have to have at least 70% morphology, a normal morphology, to pass that bull.
Yep. And so I kind of liked it how you said there's 3 main things to fertility test, and those were?
Those 3 main things is scrotal size. And it's important to remember, when I'm measuring the scrotum, it's part of the story. It's not only am I measuring, I'm feeling those. I'm feeling for hard places on the epididymis, on the tail or the head, or also on the testicle, or one testicle's maybe non-functional.
Yep.
And so it's not only measuring, but it's part of that physical exam, Dan.
Yep. So we go scrotal circumference.
And then we look at motility.
Yep.
And then we look at morphology. That is the big word for the shape of the cells. Are the heads and tails detached? Is there proximal droplets? Is there distal droplets? Is there deformed heads?
And that sets the story, folks, for, okay, that bull can get a cow pregnant. Now we're going to start walking into some of the other things, some of the myths, and some of the things that you need to be doing beyond the breeding soundness exam with Dr. Randall Spare.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
DNA Dialogue is brought to you by Igenity Beef, powered by Neogen.
To me, there are 3 main benefits of genetic testing. It can be everything as simple as calving ease, weaning weight, heifer pregnancy, stayability. Coat color, there's a commercial test for that. Horn polled would be something similar. These are all traits that matter at the end of the day, and they hit the profitability of an operation. Secondly, genomic testing can be used for parentage. One of the biggest benefits of parentage verification is really understanding, when we turn bulls out into multi-sire pastures, which ones are doing their job and which ones aren't, right? Because no one wants to turn a bull out for him to only have 3 or 4 calves a year. But also we can identify sires that are creating the calves that we like the best, that are born earlier, or maybe we can identify calving issues out of a single sire. So with the parentage, if you run that on all of your calves, then you would have a better understanding of which bulls are creating the calves that you like, maybe the ones that are born sooner or later that weigh more, or even the ones that are underperforming. And lastly, genetic testing can be used to rank replacement heifers for selection that match your breeding objectives and your operations goals, or to even create steers that meet your market.
We know how expensive it is to keep and maintain heifers. What is also the fallout of those heifers if they're not the correct ones you're keeping and maintaining? We want to do as much as we can to get it right before we spend the money to impact our herd further down that road and keep successive females out of the wrong type of females.
Igenity Beef. Contact your Neogen territory manager to test today.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with my friend and colleague, Dr. Randall Spare. He is a veterinarian in Southwest Kansas and practices all over the state. In Oklahoma, Texas has, just a tremendous veterinary practice that he has built from the ground up, and just something to be so proud of. The way you serve your clients, the way you serve others in your community. It's what veterinary medicine is all about, folks. And we're talking about breeding soundness exams, which you do thousands of them. And we've gotten through the breeding soundness exam. Now there's a few myths out there that people, it's kind of like everything, what we hear in the coffee shop, or what we hear at the bull sale, or what we hear at the auction market. What are some of those myths?
So Dan, you grew up in a veterinary family, and when your dad was practicing, and back in the time, the original test entailed a score of adding together the morphology and the motility and the scrotal size to create a score of 70. Well, that has stuck with people, and they said, well, what's this bull score? And today I go through that explanation. It's a threshold test. Is this bull going to breed today and settle cows? And that includes what we talked about, the scrotal size, the morphology, and motility. But really today I'll have people call me and say, what is this bull score? And I said, he passes. He passes. And I'm confident that he will pass. So why I want to bring that up, I talked to many people from all over the country who buy bulls from one of my seed stock producers, and they wanted to know what's he score. I said, no, he passes. Well, at the stockyards, when they test a bull, they put 90, 80, 70 on him, and that tells us how good they are. So one thing we have to remember, that a fertility test doesn't quantify the ability of a bull to breed cows.
Yeah.
It says it will breed a cow today.
Yep. And I think that's something that, you pass or you fail. And I can remember Dad sitting there, and we would do the morphology and that, and he would have his equation and come up with the score, which obviously people put some time and thought into, but really a 90 versus an 80 isn't.
That's exactly right. And the thing is, we have to remember, Dan, not every ejaculate from a bull is the same.
Right.
There are times that I'm trying to get a bull to pass or give a semen sample, and it's early spring of the year and it's been cold, and my first ejaculate may not look very good, but the bull's testicles feel good. That's the beginning of the story of this test. Those testicles feel good, and I may get 3, 4, or 5 ejaculates before I'm convinced that what I'm getting is a representative sample of what's going on there. And I would encourage producers to ask veterinarians and veterinarians to be tenacious in getting a representative sample. And I think so many of the challenges that we have today is when some veterinarians may not have the opportunity that we have to do a lot of bulls. They'll test a bull and get one ejaculate and say, he's no good, I'll test him next year, or throw him away.
The other one is this is just a snapshot in time, right? Does a bad test mean a bull is done?
No. So if the testicles feel good, I will encourage people to retest that bull in maybe 2 to 3 weeks.
And then what about it, a year later, or 2 years later, or 3 years later?
So it's important to retest that bull every year, because he can develop an infection throughout the summer. Maybe he has an ascending infection and he gets a scrotal infection, or he gets injured. Yep. It's important to do that every year before turnout, to know what you have, so that we can count on these bulls breeding a lot of cows.
Perfect. We're going to take a break. When we come back, more with Dr. Randall Spare. We're talking about breeding soundness exams in bulls, and you're watching DocTalk.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idex.com/DocTalk.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Randall Spare. Dr. Spare is a veterinarian in Ashland, Kansas. Tremendous practitioner, tremendous man, and has been a mentor for me. And so I just appreciate when we get a chance to work together. It's a blessing. And let's talk about, we've tested the bull, we've gone through the myths. We're going to kick him out in the pasture. Do we just leave it up to God then, or do we?
So Dan, one of the things that when people turn bulls out to pasture, they'll often ask them, well, how many bulls? I've got a bunch of little pastures, and I only really want to put one bull per pasture, and that makes me really nervous. But we can use that information there to help us understand. If you have one bull per pasture, it's important for you to go look at that bull every day or every other day to make sure that he, A, stays with the cow. And then if he has an injury, we need to know that and get a bull replaced in that pasture. So it's important to go out and look. A, are they lame, or do they have foot rot, develop some other lameness, or a tool injury of some sort? And it's important to observe that.
Yeah, and is the bull functioning? Is he covering cows? Lots of different things that if we aren't out there observing, you'll miss more. They say you'll miss more by not looking than you will by not knowing.
And that's important. I can do a really good exam, a physical exam and a BSE exam in April. But if he's turned out May 1st, and he could be out there 3 or 4 days and then have an injury, and he's not going to do any good. And Dan, I've pregged groups of cows in my veterinary career when there was zero bred. And it's important, and they're kind of mad at me because you tested the bull. Maybe you should have looked to see if he had a swelling underneath the sheath. Looking for those things that are abnormal and is really important. Great opportunity to observe.
Yep. Any other words of wisdom with, like when you turn bulls out, or things that producers should be looking at or be thinking about?
So often we're asked, well, how many bulls should I turn out? And the first thing I ask, well, how old are those bulls? And, if we have to buy yearling bulls today, or bulls that are 13 to 15 months of age, kind of a good rule of thumb is one cow per month of age of those bulls. So if they're a 15-month old bull, let's put him with 15 cows. And I would say try as the best as you can, put out the same ages within each pasture, because you don't want mature bulls beating up on these young bulls, and they'll make them pretty timid. And we'll give everybody an opportunity to breed if we do that. And I think that's real important.
Yeah, I agree. So I love that rule of thumb that for a cow per month of age. And then what's the threshold then on some of these?
So as far as age,
Yeah,
I've depending on the practice and their management style, I have some people that dry lot their cows during breeding season, and that bull's eating out of a bunk. And I've fertility tested bulls, and I said, how old is this bull? Well, I don't know. So we look at it. He has about 4 teeth left, or he has pearls, but he was in great condition, and he's producing great semen. I think that might have been a little bit old. But we have to remember, we want them to be like college athletes, and we want to be out looking for bulls or looking for cows to breed. So I think in my rule of thumb, you get to 6 and 7 years of age, it's time to go on. I think we have to remember, because not only are they probably at the end of their breeding life, there's better bulls to be purchased if we're really going to increase the genetic profile of our herd.
Absolutely. Well, thanks for being on the show. Great show today.
Just thanks for the opportunity, Dan, and thanks for what you do for our profession. We appreciate it very much.
We're going to keep charging on. Dr. Randall Spare. Thanks for watching Doc Talk. Remember, if you want to know what we do, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thompson with Dr. Randall Spare, and we'll see you down the road.
Doc Talk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.